Today's session will, of course, focus on women's health, but not just women's health, how this can relate to outcomes within your business and how we can help you hopefully understand how your business can be truly inclusive, caring, and attract and develop the very best female talent.
So let's dive straight in. So 21% of women have passed on a promotion. 61% of women think that motherhood disrupts their progress. And could that be seen as why several women actually work part-time in comparison to men? A huge 72% are saying that this causes conflicts in terms of the work-life balance. And studies show that on average, a woman spends about 4 hours and 25 minutes a day doing unpaid care work. So there are a few more statistics there that I'm going to leave on there to read. You can see here that starting at entry level, it almost appears as quite an equal ratio of male to female employees. However, when jumping to management positions, we can already start to see an imbalance occurring here. This decline then continues as we move on to senior director roles, vice president roles, and then finally C-suite positions, where only 26% of women sit. Now, there is a multitude of factors that play into this. And from the statistics shared a moment ago, one of the key takeaways was that many women are leaving the workforce due to conflict with work-life balance, especially around starting a family. It is clear that balancing these alongside work obligations is tough. And as you typically proceed up that corporate ladder up to the C-suite positions, the obligations are only going to increase and intensify. And still to this day, there is an awful lot of pressure that women feel by society to put family ahead of career. Well, when I give advice to a lot of my clients and we sort of dive into the culture, the workforce, there's a variety of aspects we can look at here. And a key one to start with could be something like employee benefits. So when designing an employee benefit scheme, it is so important to look at the wider lifestyle trends of your female employees. And I have to say, from sort of 9 years experience in the industry, the employee benefits market is seeing some incredible enhancements in support services and insurance policies. You have policies in place now that exist in the market solely around women's health and well-being. A great example there would be private medical insurance. Typically speaking, menopause, as an example, is a condition that is often excluded as this falls under aging. However, insurers have realised that this is not good enough and that the changes a woman experiences during menopause are huge and massively impacts us. And through this acknowledgement, a lot of insurers have now enhanced their proposition to include access to menopause helplines, prescriptions for HRT, and specialised consultations. And this leads me quite nicely on to another area to explore, which is period and menopause support within the workplace. So a great way to start is, as a company, start making a statement and open up conversations that menopause is a recognised occupational health issue and also a gender and age equality issue. When it comes to periods, remove the taboo around menstruation at work. Even things like offering free or subsidised period products or an emergency supply store can be such an effective statement of acknowledgement, which is then continuing to remove that taboo element.
Yes, well, hello everybody. My name is Natalie. Give you just a brief background of my career. I started in commodities in the US. I was there for quite a long time, and then came back to the UK and spent the next 10 years in FS and insurance. I then had the great opportunity to go and work in India in the automotive sector and encouraging young Indian women into the workplace, which was fantastic. I then went to work for an NGO at an international level, and then latterly joined Partners And 4 years ago. So it's nice to be back home in FS again.
Well, being an industry then, which by nature is typically dominated by males, how do you measure the effectiveness and impact that our initiatives have and how they relate to women in the workplace?
Thanks, Susie. That's a great question. Well, firstly, we like to buck the trend at Partners And. So our demographic and split is 52% women. So that's a great starting point for us. And many women are represented at a leadership level. So to your point around C-suite. As part of our BEAT program is our brand for our ED&I initiatives. And one of the first two that we set up was the Women's Network and the Menopause Network. We actually started talking about menopause at the start of this company in 2020, which was fantastic because that then started the conversation. We were accredited in 2021 and we're just going through our re-accreditation now. We're also looking to start our accreditation for menstruation in 2025. Just an interesting phenomena and something I just wanted to highlight that, menopause and women's issues are not just about women, they're about men. If you look at the case study of the Southeast train drivers, their absence rates went through the roof, and it was because they weren't getting enough sleep because their wives or partners were going through the menopause.
Thanks very much, Dan, and thanks for having me. So my name is Carolina. I'm a consultant gynecologist by background. I've worked in the NHS and in private medicine as well, and also work as the Chief Medical Officer at Syrona Health. So when we talk about women in the workplace, there are over 15 million women who are at work in the UK. And that is, 44% women are in full-time work. And that contributes to a large proportion of the workforce. And I think it's important just to say that, from the offset, the roles of women have significantly changed with regards to their roles in the workplace. On average, we live 5 years longer than men. But often the last 9 years of our lives are in more ill health. We're not living better lives. We're living longer, but generally suffering with more chronic conditions. And this can range, for example, we're more likely as we get older to suffer, for example, fractures. These fractures means that we're more likely to have disabilities, and the fractures may result from osteoporosis and a whole other avenue of different chronic conditions. So we need to thrive, not just survive as women. I certainly, in my older years, as I'm staring at them, I want to live a healthier life, not just a longer life. This is published data, and it shows that we have the largest female health gap in all of the G20 countries, and that's the 12th largest globally. And we really need to be doing more things to change this. Women also tend to be primary carers for children. I know it was already touched upon how we have these unpaid caring roles, but also actually my generation specifically, we fall into this sandwich generation where we're also looking after our elderly parents as well as, for example, younger children. We're tending to have children later as well. And as a result of that, that's impacting the dynamic of everything. And as I've said, we're also more likely to suffer from chronic health conditions. When we talk about women's health conditions specifically, what I wanted to do was touch on a few of these. So these are things like endometriosis, polycystic ovarian syndrome, and both of these conditions are chronic conditions for which we don't have a cure. So it's about living well with these diseases and managing it accordingly. Equally, fibroids is probably the most common thing a gynecologist will see. Fibroids tend to cause pelvic pain and heavy periods, but it can also impact on a woman's fertility. And the idea of this slide is to really explain how these are all actually interlinked. So fertility can be impacted by fibroids, but also by cancer and potentially cancer treatment that women might have experienced. and also menopause. And we've seen there's been a huge spotlight on menopause. So we've seen huge numbers of women having to leave the workforce as a result of menopause symptoms, for example. And without recognizing the impact that these conditions have on women's health, this can affect productivity, and ultimately it limits the potential of not only the individual, but also of the organization. Okay, so in terms of solutions, so we talked a lot about the barriers, so chronic conditions, and the fact that often, depending on your employee benefits, on the insurance that you've got, historically, they don't often cover these chronic conditions, which actually puts women already on a back foot. Because it would be seen as a potentially pre-existing condition. So I think that's something that really needs to be highlighted, and that's why having women's health add-ons is really, really important. In terms of legal aspects, so for example, if we take endometriosis can be considered as a disability if you've got significant pelvic pain, which is impacting on your ability to do certain things. And I think it's important to be able to recognise that and understand that as well, so to be able to support patients, women appropriately. And also we've seen that in the aftermath of COVID, there is definitely a greater focus on health of employees and on wellbeing policies. And people are certainly looking for that in the workplace. They really want to feel valued and supported by their employers. I think some of the take-home messages is we just need to destigmatize this aspect of chronic health and mental health. We need to be able to talk about it very freely. We need to be able to increase demand to expand the services on offer. Expansion, people always think that that's expensive, but that's not necessarily the case. I think by using digital health, actually, you can certainly optimize and keep costs down. And digital health solutions are great for delivering specifically also as well holistic treatment options. And it also is important to provide access to information, but the right information that women are looking for, and have awareness in the workplace of this.
Thanks, Jan, and thank you very much for having me. So I'm a partner in the employment team at Burges Salmon. The first question I really wanted to pose was, why is the conversation around women's health issues so important? But I think we've heard lots and lots already today on why that is the case. I mean, certainly the statistics on this slide suggest that there is a trend that may in part be due to how employers treat their health and wellbeing concerns, whether this is about childcare, caring responsibility, menopause, mental health, other health concerns. So there is quite a problem here, not least that we see that when women leave the workforce before reaching senior management levels, employees lose valuable mentors and boards lose talent. And those people would otherwise be able to contribute to a better understanding of how to address female-specific health and wellbeing concerns from the top down. Many employers already have policies and procedures in place, in many cases based on or prompted by those legal requirements. But, and this is the reason for the big circle on the slide, which encompasses all the other areas, in order to be seen as an environment that attracts women, retains women, supports, rewards, and promotes women, there needs to be a broader change than the law currently offers, and that is in relation to culture, something that Izzy talked about quite a bit at the beginning of this session. So that means recognising existing legal protections, but going further, and this is something I'll come back to at the end if there's time. An effective change in culture requires employers not only to embrace those legal protections, because these are, after all, the minimum protection an employer must afford its employees, but also to take a step back and consider the many ways they could seek to address and bring about change in relation to the challenging statistics we've seen throughout the session today. The benefits are many, but would also include a reduction in legal risk. So just also picking up on something that Carolina was talking about, distinguishing yourself as an employer who genuinely cares about these topics and has a proven record of implementing workable policies with senior level buy-in will facilitate attraction and retention of the best talent, both male and female. And certainly continuous recruitment cycles and high staff turnovers are problematic for lots of reasons, whether that's cost, facilitating knowledge transfer, or losing diversity of thought. As an example, I wanted to touch on a new piece of law that goes to women's health and well-being in the workplace, most specifically their psychological safety, and how this is linked to a bigger cultural shift in the workplace. In October, employers will be under a new duty to prevent sexual harassment in the workplace. They will be required to demonstrate that they have implemented reasonable steps to do so. It's probably also worth just mentioning before we leave this section that more change could be in store if we see a Labour government after the general election. Labour has suggested that it would introduce a requirement for companies with over 250 people to have and implement an action plan to support women with menopause. And actually in their manifesto, they've also referenced menopause discrimination. Not quite sure what that might mean. Perhaps it would be actually introducing menopause discrimination and menopause as a protected characteristic under the Equality Act, as has been tried before. Many employers will already have lots of good policies and practices in place, but I would urge you to keep them under constant review, as this is a constantly revolving area.
How can businesses ensure that employee benefits are seen as part of a business's well-being strategy rather than sitting outside of this framework? I think we too often will see benefits here, well-being strategy here, but do you think they should be a bit more connected?
Completely. So, and it really comes down to that initial engagement and awareness piece from offset. So they need to work in harmony, because ultimately you're investing in benefits which you want to see an outcome of an improved well-being and workforce. So you need to bring them aligned. Keeping them separately, we've seen it, the novelty of it wears off quite quick. You have individuals not really understanding what benefits they have or how to use them, and there's confusion. So I think bringing it together really is the key for the success.